Hello, my name is Jason Davis, and the purpose of this presentation is to discuss my professional nursing philosophy. In addition, I will also discuss my personal ethics and values, attitudes and dispositions, and my future role as a psychiatric mental health nurse practitioner. My professional nursing philosophy begins with the belief that all human beings have inherent self-worth and that they have the right to receive medical and mental health care from competent professionals in a timely manner. Unfortunately, today I believe that many healthcare professionals, including nurses, are too concerned or occupied with health restoration and illness prevention, and have forgotten about health promotion, the most important of the three concepts. Most healthcare professionals have a goal of simply returning a patient to a neutral position on the wellness-illness continuum. They either do not realize it or have simply dismissed the correlations between health promotion and a higher level of wellness. I believe that through health promotion, a person will not only prevent illness and restore health, but increase their overall level of wellness. Gene Watson is a nursing theorist that I closely identify with, mainly because the central theme of Gene Watson's theory of human caring is that nursing is based on human values and interest in the welfare of others and is concerned with health promotion, health restoration, and illness prevention. Her science of caring is built upon 10 curative factors, but it is the first 4 curative factors that form the philosophical foundation for the science of caring and makes up a large part of my nursing philosophy. Gene Watson's first curative factor is the formation of a humanistic, altruistic system of values. The second curative factor is the installation of faith and hope. The third is the cultivation of sensitivity to oneself and to others. And the fourth is the development of a helping and trusting relationship. My personal and professional ethics are defined by the values and morals, which are a unique blend obtained through world experiences, my nursing education, and my professional experiences. Having grown up in the Western culture, individuality and autonomy strongly guide my beliefs and actions. I believe that every human being is a unique product of their experiences, and that no one set of solutions is right for everyone facing the same set of circumstances. Culture, religious beliefs, and worldviews may figure to various degrees into my patient's decision-making process, and lead to different opinions about the appropriateness of certain healthcare options. For this reason, I will always respect and support my patients' choices related to their healthcare choices. Furthermore, my personal values would be meaningless without compassion. Because of this, I believe that compassion forms the basis for the nurse-patient relationship and paves the way to develop the other important aspects of that relationship, such as trust and cooperation. My compassion and caring will always be reflected in my practice when I talk to the patient about their goals, and I will always work together with each of them to achieve their goals. I believe that when patients are involved in the planning of their healthcare goals, they are more likely to be successful in achieving their goals. In addition to the above values, I also believe that it is my responsibility to advocate for the rights of all my patients and maintain their confidentiality at all times. I also believe that patients deserve to be cared for in a timely and professional manner, and that communication with patients should always be truthful and accurate. And finally, I believe that it is my duty to promote the highest level of moral and ethical principles by accepting full responsibility for the care that I provide. My theoretical framework also contains 6 attitudes or dispositions that reflect my personal values mentioned on the previous slide. These attitudes are a confidence in my abilities as a nurse, a thoroughness that exceeds what is required of me, a respect for my patient's privacy, patience when dealing with emotional patients and their family members, an understanding that allows me to hear all of my patients' questions and concerns, and honesty when responding to those questions and concerns. As a future mental health nurse practitioner, I plan to make it my priority to be a leader in my community and profession so that I can help facilitate change to a more proactive system of mental health care. My main goals as a mental health nurse practitioner will be focused on improving healthcare for individuals who are suffering from mental health and addiction disorders. I believe that mental health and addictions need to become much more of a public health priority because our current mental health system of care needs to be redesigned from its current reactive-only interventions to a much more proactive system of care. I believe in order for this change to occur, federal, state, and local governments, as well as those in the mental health field, will need to move forward with real action to support and sustain effective and efficient treatment services for individuals who have mental health and addiction disorders. As a future mental health nurse practitioner, I will help facilitate this change by educating both my patients, their families, and the community that I live in, so we can begin to remove the stigma that is so often associated with mental health disorders. I will also emphasize and support early detection programs such as youth screenings, school-based substance abuse programs, and improving behavioral health screenings and treatment in primary care settings. Above all else, I will continue to advocate for any and all individuals who suffer from mental health and addiction disorders.